Okay, we'll call the committee of the whole meeting for January 24th to order at 12:30 p.m. I'll ask for a motion from Councillor Barton that the committee of the whole adopt the agenda for the committee of the whole meeting January 24th as presented.
Yeah, my motion, Mr. Mayor. Yeah, my motion.
Thank you. All any questions, comments? Councillor Jones.
Thank you, Mayor Snodgrass. If I had something I wanted to add to the agenda, would this be where I would do it?
You got her, yep.
Could I add revisiting the policy COVID-19 pandemic response of employee vaccination to this meeting?
You betcha. We will add that. Will be item 4.3.
Thank you.
Thank you. Friendly amendment on your amendment, Councillor Barton, that we add vaccine mandate. I don't know what to actually call it. Vaccine mandate to the agenda. So your motion would be amended.
That's fine, Mr. Mayor.
Thank you. Councillor Killick-Smith.
Thank you, Mayor. I would like to also add, if we could, discussion around the winter maintenance contract that's scheduled for our regular meeting today. Just want some points of clarification if we can. Is that now, or would that be at the actual meeting?
I think we'll do it at the actual meeting because it's already on that agenda.
Okay.
Kelly, if that's okay.
Sure. Yeah, that's fine.
Okay, and we'll do it then. That way we'll do it all in one because I've got a list of questions as well on that one.
Very good. Thank you.
So Councillor Barton's amended agenda motion, all in favor? Carried. Ask for a motion from, how many do we got here? Just one. Ask for a motion from Councillor Kinghorn that the committee of the whole adopt the minutes from January 10th, committee of the whole meeting as presented.
Thank you, Mayor. I'll give you that motion.
Thank you. Questions, comments? All in favor? Carried. Town Plan Task Force. Halid.
Thank you, Mr. Mayor. Good afternoon, Mr. Mayor and Council. I'll just provide you with a summary of the report that's attached to the agenda package regarding the proposed terms of reference for the proposed task force. If Council recall, at the November 12, 2019 regular meeting of Council, we presented a report regarding plans to draft the steering committee bylaw for the rewrite of the town plan, as well as intentions to put out a call for nominations for members of the public to serve on that steering committee. At the January 27, 2020 regular council meeting, council passed a bylaw for establishing a steering committee for the initial review of the town plan. Based on that bylaw, administration initiated the recruitment process for the steering committee, and we've received 2 applications from interested residents. However, due to the COVID-19, the recruitment process was put on hold, and the steering committee was never established. During that time, to maintain the momentum, administration completed background research on the process that we have used to develop the current town plan, and also engaged a consulting firm to assist with 2 workshops. One workshop with administration and another workshop combined administration and council, members of council. The workshops were intended to foster a great awareness and understanding between the various departments and members of council. And the result of the workshops and our review or background review were presented to council, the committee of the whole, and an administration was directed to proceed with the implementation of an integrated approach to the town plan rewrite project, which included establishing steering committee for the duration of the project, which was expected at that time to take between 18 to 24 months, instead of just completing an initial review to the town plan. And also, the direction included hiring a consulting firm to co-lead the project with town administration. Based on further internal review and discussions, and due to the proposed aggressive timeline that we have now included in the RFP, the new town plan review process is going to be completed within 11 months or less. And so based on that, town administration realized that creating a task force for supporting the rewrite of the town plan could be more efficient or effective than establishing a steering committee with the bylaw and whatnot. And it's also aligned with council direction regarding establishing new committees and whatnot. So that's why we are proposing a task force instead of a steering committee. And the purpose of the task force as an advisory body is to really participate in the review and rewrite of the town plan, including providing advice and guidance to the project manager regarding how the town plan should be rewritten to achieve the goals and the objectives of the project. There are many documents and elements that would be considered by the task force during the review process, including the MGA, South Saskatchewan Regional Plan, the Calgary Metropolitan Regional Growth Plan, Council Strategic Plan and Priorities, the Land Use Bylaw, Town ARP, Community Priorities, Best Planning Practices, Climate Change, Environmental Considerations, Housing Strategies, Transportation, and the list goes on and on. The structure of the task force is proposed to be comprised of 9 members appointed by council. This would include 4 members at large and 3 members of council, 1 member of the mayor's youth advisory council, and then the mayor. So it will be in total 9 members. They will meet and select their secretary, their chairperson, and off we go. Our recommendation is really very simple: is to for council, if no concerns, to adopt by resolution the proposed terms of reference and direct administration to proceed with the recruitment process to establish membership of the task force. That concludes my summary, and are there any questions?
Thanks, Khalid. Well done. Pretty much direct down the line that you were directed to do. So, any questions from council? Councillor Kinghorn.
Thank you, Mayor Snodgrass. I just have a question around item 19, Khalid, where we talk about the motion is not supported unanimously by the TFTP. Members must decide the matter, and you have ABC there. Is that kind of normal for a task force, or is it majority rule? Or I thought that was interesting to see how you presented that.
It's a great question, Councillor Kinghorn. Normally, during such a community project, it is never expected that people will resort to voting. Basically, it's very commonly that people will normally work by unanimous support. They always agree because it's about the vision, it's about the future. Very rare that people kind of tend to make a decision through voting. And so it's just in case, but I don't think even we would get there.
Answers your question, Jamie?
Yep. Thanks, Khalid. Well done.
No further questions. We'll continue on. Thanks very much, Khalid. Take it to the regular meeting.
Thank you.
Broadband summary update. So this was rewinding from our strategic session where broadband came up, and there were questions about our little process we went through a few years ago to try to get broadband throughout downtown High River, and why we did it and why we abandoned it. So I'll leave it for Riley to update you.
Sorry, muted there, talking to myself again. I have a PowerPoint which Jody's going to put up on the screen for me.
Yes, I will. That is coming. Thank you, Riley.
Thanks, Jody.
I'm hoping you can see that now.
Yes, thank you.
Okay.
Kent's also available should there be questions near the end. And Mayor Snodgrass, I'm hoping you could answer and fill in some gaps as well. I think you were quite a bit more involved than I was in probably the first 3/4 of the project. So both your and Kent's input would be valuable. So first slide. Sorry?
We can do that.
Thank you. First slide. Oh, that was actually an approved. Eventually we were actually talking about branding, and that was the approved logo for what we were doing. The High River Connect logo. This slide, Jody, stay still, is a quote from the Twist marketing report. It's referred to in the package. We did remove it from the package last minute because it was over 250 pages, and really it's only these 2 lines that were relevant. Would be happy to share it should anyone have questions, but we didn't want to bloat the package just because of the one report. So essentially, after the flood, economic development became one of the pillars of recovery. Through that, the Twist marketing report was done, which identified as broadband as a potential tool to promote business and growth. So that was kind of the start of it. The mayor's task force took that, they ran with it. Eventually, a contract was awarded to IBI. Next slide, please, Jody. And IBI went through quite a bit of analysis with regards to market assessment, network designs, business models. They did a lot of public engagement in terms of what do you have now, what do you need, what are you willing to pay, those kind of questions. Kind of concurrent with this, we did do a bunch of work with regards to talking to vendors or operators like ONET in regards to how that impacts our business model options. We also got our CRTC license to be able to provide broadband and all sorts of analysis. That report is attached, and if you, some light reading there for you at night. Ultimately, we kind of came to a solution and moved into design. So next slide, Jody. Design was, here's the scope of the design. So it was primarily downtown with a little bit extra to the south. Here's the kind of main trunks where the fiber would go. There was a lot of conversation around things like the POP, which is the point of presence or the main interconnect, and where that would go. Ultimately, we decided on Town Hall. But that's the general gist of what the design looked like. Next slide, please, Jody. We tendered out in fall of 2018. We didn't have a lot of interest. we were concerned with the pricing. There was issues with winter construction, and ultimately we decided to shelf that and retender it out in spring. We did retender it. The scope was slightly different, and it came back quite a bit higher. The scope amendments did not justify the increase. We weren't quite sure why there was an increase. We did do quite a bit of analysis on the bids, and we did have more bids the second time round. So we were happy with the pricing, but it still was quite expensive. Given that, we did have concerns over viability of the project. Next slide, please, Jody. So given those concerns and the price we received, we reevaluated all the assumptions with regards to the project. These were the assumptions. They're a little bit different than what was in the IBI report. At this point, we were starting to get concerned around the initial penetration and what our uptake on the service would be, as well as costs. And so we restated the assumptions. We redid the calculations in the background in terms of what that would mean. And next slide, please, Jody. Ultimately, a 30-year cash flow projection was created. And after 30 years, we were still, I forget the exact number, a little over 800,000 in the hole in terms of where we would be with that project. And so it was debated with council in terms of what the correct assumptions would be. Can we improve that scenario? Could we look at a different scope or piecemeals or special cases? And ultimately, the project was canceled. And council passed resolution to cancel the debt bylaw. And that was the end of the project. So that is it in a very high level summary. Kent or Mayor Snodgrass, anything to add?
No, covered it well.
I kind of glossed over speaking of which, I kind of glossed over the fact that as part of the IBI, kind of near the beginning, we did talk a lot with the other providers in town, being TELUS, Shaw, Bell. I think it was the three. Oh, Axia. Bell owns SuperNet, which is why Bell was involved in the conversation in terms of what their plans were and if we could help them come to market quicker. And we couldn't come to an arrangement with any of those providers.
So yeah, this all started out of the two studies that come out of our post-flood economic development research that we were doing. And of course, the low-hanging fruit is broadband. And we had been talking with TELUS, and that kind of fell through for a couple of reasons. But at the end of the day, TELUS really didn't have any interest in putting broadband into High River anytime soon was the reality of it. Same with Shaw and Bell. Axia is a different one to get involved in. It's one of those things like Nanton does it, and there's definitely mixed reviews on how that's working out in Nanton. But you know, for the big three players, none of them had any interest of bringing broadband in, you know, not just to downtown, but throughout High River anytime soon. So that's why we started looking into this. And at the start, the numbers were making sense. Everything was going good, and until the scope had to change a little bit just to certain things underground that they'd found as to where they got to go and how they got to route things. But then when it was retendered, the capital cost went through the roof. Minimum doubled, but more like tripled. And we just felt that the other thing that we found that there was a very low amount of uptake from our existing businesses downtown, the people that wanted to be involved in this and would take on the $10,000 installation charge, and that's fairly normal for anybody, but I was hopeful to it, to the point when we built our new building down there, I put fiber into it, to the whole place, thinking I was just gonna be able to plug in next year, but didn't work out that way. At the end of the day, there is a huge risk for the town of High River and getting involved in this, and the ROI on the whole project was so far out that it just did not make sense. So we thought, yeah, we spent some money on getting there and figuring it out, but rather than continuing to spend money on a proposition we knew was a losing venture, then we shut it off. So as I've said before, any of the other TELUS, Bell, Shaw, anybody wants to come in and put broadband in this town, the doors are open, and it's up to them if they want to do that, if they see a market there, and that's the big thing. So pretty simple. Councillor Kinghorn first.
Yeah, and I was part of that team when we looked at that. And one of the things that frustrated me, Mayor Snodgrass, is that there were a number of the so-called big businesses that we were going to get, i.e. the banks and the school board, were already connected to fiber. Is that, my recollection is correct on that?
Yep. Yeah, they all got their own.
So, yeah, they already had their own. So there was a number of what I considered to be very viable businesses that were set up with it and would not be signing up to ours. But thank you.
Yeah. You are. Councillor Barton.
Actually, Danny Kinghorn's comments are kind of cleared up what I was going to say. So
Good. Thank you. Councillor Killick-Smith.
Thank you, Mayor. I'm just curious, was there ever, like, has this information is now a couple of years old, and is there any sense of any sort of change in terms of the providers and their willingness in our community? Like, have we asked that question of them? And I mean, given that the whole world went online with COVID, has that changed the priority in that sense, like from the service delivery, I guess?
I don't think we've gone out and asked. Well, I know we haven't gone out and specifically asked them to do that. I don't hear a lot about it anymore, Kelly, since, Shaw has a 750 and they got a 1 gig service for businesses that I use and provide. We do a lot of video stuff at work, and it gives me everything I need. So, what the real uptake is on it is the deciding factor. Is there enough residents to do a residential build? Is there enough businesses to do a commercial build, right, for these guys? So, we can go ask them, of course, but 99% of the time they know what's going on in our community much more than we do.
Sure.
On that end, right? So
yeah. Thank you, Mayor.
You're welcome. Councillor Jones.
Thank you, Mayor Snodgrass. I'm wondering why the providers are not interested in collaborating or taking on any of this.
I think it's business. I think it's the market availability. I think it's that's what Axia does, Jenny. Axia is the different one where I don't really know how they get their money or how they operate, but they've got a website. And what is it, Riley? Or Kent would know too, but you get 10% or 15% of your community that says, yes, we're interested. Then they come in and blanket your town with, right? To blanket your town with fiber. Okay. Okay, with Bell. Yeah. Okay. There's more than I knew, Jenny. Thanks, Kent. Any other questions? Thanks very much, Riley. Thanks, Kent.
Thank you.
What did I say the vaccine was? 4.3? Is that right? Brought up by Councillor Jones. So Jenny, I'll give you the floor on your questions regarding the vaccine employee mandate.
Thank you, Mayor Snodgrass. So really the purpose of the policy was to keep employees healthy and safe in the workplace and provide high standards of service to the people of our town. And as we've seen, the virus is changing, ever changing, and the new variants are spreading indiscriminately amongst the staff as well as our town's population. We've had to cut back hours and service at different locations because of staff that are out ill and possibly due to COVID. And the town does have qualified staff that aren't working due to the limitations that this policy provides, I guess. And it seems like this policy is not actually sort of meeting or resulting in the desired outcomes that it was intended for. I mean, as the virus evolves and becomes less severe, we need to look at the needs of our town and what impact this policy is having. My thoughts.
Too many things popping up over my mute button. Sorry, Jenny. Chris, do you want to respond?
Certainly the variants do pose a challenge to us, but with any illness that goes through a community, we're going to be challenged the same way, be it the flu, be it a cold, from that perspective. Ultimately, the whole goal of our policy was to get as many of our staff vaccinated as possible to, one, limit the severe outcomes that they may be exposed to, that we can continue on as best we can with our core levels of service, which recreation is not necessarily a core level of service or an essential service within our operations, and to support the government and the provincial government and the AHS in helping to battle the spread of COVID throughout the community. That was the original intent, and it still is still that intent. It has become evident through some of the studies that this current variant, while it is spreading through people that are vaccinated, those that are vaccinated are significantly seeing less severe outcomes. And just for council's information, we have almost 91% of our staff fully vaccinated with double doses. We've got 13 staff members, or 6.5%, that are taking the testing route. We've got 4 that are on leaves of absences. And then we have 1 that's on a medical deferral at this point in time. So we've got a high rate of staff that are already double vaccinated. And this policy is still proving, in our view, very positive from that perspective. In addition, it gives a sense of safety and security to our existing staff and some members of our community that are very happy to know that our staff are vaccinated and double vaxxed or following a testing regime. We've had comments from staff that they feel safe coming into the office, that they feel safe coming into recreation, that they feel safe coming into operations, knowing that their co-workers are fully vaxxed or are following a testing regime. So there is that sense of security that it does provide. So it is still a valuable tool. It is certainly, we brought this forward to council to have the full support across both the political and administrative spheres of influence. And we wanted to show leadership throughout the community that vaccinations were very important to move us through the COVID-19 pandemic and move that into a different stage. Once we're through the pandemic, maybe we do take another look at what the policy looks like and what the policy reads. But until we're out of that pandemic, I would say that it's premature to be having any consideration for changing this policy at this point. Thank you.
Thanks, Chris. Councillor Barton.
Thanks, Mayor. Chris, a quick question about testing procedures right now. From what I understand, there's a staff member that's being moved out of a position right now because he's continuing to do testing, but he's not, I don't know, he's been asked to move to a different department. And so I'm wondering if testing is now not acceptable manner of compliance, I guess.
Councillor Barton, testing is still a perfectly fine opportunity. We are getting some challenges, certainly with the testing regime, and we have debated a full-on mandatory vaccination policy for all employees and no testing option. We haven't really explored that much in detail and are kind of steering clear of that right now. But it is a conversation that we have on a rather weekly basis and moving forward from there. That situation you just mentioned, I don't know very many details about what's going on there, and that's a specific incident talking about a specific staff member. And if we're going to talk about that issue, we should probably talk about that in camera session from that perspective.
Absolutely, and it was just brought up to me just prior to this meeting, so I'll send you guys the details so that you understand where this comment was coming from. And I guess
and just one comment on that one, Councillor Barton.
Yeah.
That person may be moved, but they're still working. They're still doing work for us, and they may not be doing their preferred work, but they're still doing work in a much safer location.
Oh, okay. Yeah, fair enough. We'll continue that conversation in an email. So thanks, Chris.
Councillor Jones.
Thanks, Mayor Snodgrass. So I guess my lack of understanding in the fact that why, if anybody could get it, transmit it, and be off work regardless of their vaccination state, why are we discriminative in the fact that only certain people have to test? Why wouldn't everybody have to test?
Every employee gets a choice, and their choice was to either get vaccinated and not have to follow the testing regime, or get tested to continue working or take a leave of absence. That was their choice.
I know that's the policy, but what I'm saying is that this times have changed. The virus has changed.
Yeah,
it is not solely unvaccinated people that are getting sick. You had, everyone's following the rules, and yet businesses are having to, reduce hours and shut down and, still work from home. I get that, but it's not, it's kind of a discrimination at this point, being that we're kind of on equal, an equal field of who can get it and how they can get
it. I guess that's one perspective, Councillor Jones, and one opinion. Certainly, we went through the whole conversation about discriminatory practices, and what we've done in this policy is not discriminatory in any manner under the Canadian Charter of Rights and Freedoms. It follows the Human Rights Tribunal and their guidelines that they've laid out. It gives people a choice and an option. It is an unprecedented pandemic that we are in, with reasonable response to the grounds that we are responding to with dealing with that pandemic. And this policy remains that reasonable response to ensure the maximum amount of safety for our employees, as well as community spread from that perspective. Viruses are going to change, and I can't dispute that. But we do see the evidence very clearly that even with our employees that are off sick, we don't know if it's COVID, cold, or flu, because we don't have access to the PCR testing to confirm that data. And rapid testing has not necessarily proved to be conclusive, and the high rates of failure of that testing results as well. So we know that people are off ill, and people, no matter how ill they are, if they are sick, they should not be coming to work, period. And that's our philosophy moving forward. So even after the pandemic's over, if you're sick, you should not be coming to work, period. And that's going to be something that we'll be setting up within our code of conduct at a future policy discussion as well. So I hope that answers your question, Councillor Jones.
Well, I do agree with that particular policy, which leads to everybody being, again, on the same playing field. If you're sick, you're stay at home. You're not, I guess, discriminated against because of a choice that right now does not seem to be making any difference.
It is the choice of the minority within our organization, and a very small minority at that. And our information and our collection of details from our staff was their preference was to make sure that they were safe at the workplace. And this is one of those tools that allows us to make sure that our staff feel safe coming to the workplace. And we feel that it's a valid tool that still is in effect right now until the pandemic is actually over and it's declared over by AHS. And we move past that process and move into an endemic stage, whenever that may be.
Is that particular item in the policy? Because I didn't see that. Like, when does it end?
There is no sunset clause on the policy. That will come forward when we feel comfortable bringing forward a recommendation to council to rescind it. We may never rescind. At the end of the day, the science is still out on COVID-19. It may flare up. There may be other variants. There may be more severe variants that hit the population that vaccinations will be required. So I think it's something that not only as we talk about COVID-19, but if council does remember, both in 2019 and 2017, there was also the sphere of flu pandemics with both the avian flu and the swine flu. And both of those really came out with very, very firm vaccination, not mandates, but encouragement of vaccinations at that stage in both 2007 and 2009, and different parameters for dealing with social interaction as well. And so there are going to be other pandemics along the line. How severe they are is going to be depending on what the virus is and how it actually hits certain populations. Certainly, our response has been very consistent over time from the very outset. We've taken a very cautious approach, and we've been listening to the data that we've been collecting from the Chief Medical Officer, the province, the Chief Medical Officer of Canada, as well as our local doctors who fed back into our feedback loop. And it's become clear from our doctors in our rural network that they strongly advise everybody to get vaccinated. That the way out of this pandemic is through vaccinations and to move into the endemic stage. So when this policy will be revisited will be when the pandemic's over. We'll make that decision internally at an administrative level, whether to bring that forward or at the request of council to bring it forward.
And a big piece of this, Jenny, was, going back when the government gave us two options. The rec centers are the big trigger for so much of this, right? And when the province gave us two options, is to either do the REP program or the 1/3 capacity thing, in order for us to keep our doors open and to keep as many programs going for as many people as we possibly could in High River. It's the REP program that worked. Otherwise, we're canceling all the pickleball and adult programming and everything, right? It's a big impact to a lot of people. And so when we were saying that, well, we're going to be at the door asking for everybody's vaccine passports, it's only fair that we make sure that all the employees that they're going to be engaging with at the rec center, that the public is assured that they're safe when they come in and that they're following along the same guidelines, right? So that's where it is. I agree. As far as the vaccine goes, the vaccine is not designed to cure or prevent you from getting COVID. That's just not how it works. The way it works is that it's there to lessen your symptoms and keep you out of the hospitals and everything else. And that's just the way it works. So exactly the same as our chickenpox vaccine, right? So that's the thing, is that's where the trigger points for the government are watching is, ICU and hospitalizations. That's their big one, and the number of people that are being vaccinated. So those are the triggers that the government's watching, and the two mandates, the two choices, the REP or the 1/3 capacity. Those are the things that they've implemented on us, and we've got to abide by them and choose as we see fit. That's where a lot of it came from.
Well, I do understand the REP program, and I do know that workers don't fall under that. So that was a choice of the town to follow, to make that decision for sure.
Yeah.
Because workers in an environment are what they consider out of scope, right?
Right. Yeah.
And with the vaccination not, curing, and I'm not saying it's supposed to, but maybe we need to look at policy differently, right? Like you said, if people are sick, stay home. Let's have that policy instead of this, pinpointing only what you said 91. So 9% of our staff, right? I don't know. The policy just seems to have outgrown itself.
Yeah.
None of this is easy, any ounce of it. And it's brutal decisions that have to be made. And as we all know, not everybody's on the same page with it. And you got to be, but our role in these positions, and this is a decision made by Chris and his administrative staff to do this, and it was one that was that previous council wanted to publicly support what they were doing, and we did that. But this is a decision made to best suit our community and to keep our staff protected as best we possibly can. Not everybody's going to agree with it. Go the other way. Not everybody's going to agree with it. So.
No, and as times change, we need to revisit it for sure. And in my opinion, times have changed, right?
Yeah. Yeah. And listening to the radio this morning, there are a couple of doctors on there saying, okay, they feel that we're hitting at the peak. So of hospitalizations and case numbers and everything else. So that's what they're watching, and that's what we'll continue to monitor. And as things come down and better, then we make the decision as to where we're going with it as well. No question. Councillor Kinghorn.
Thank you, Mayor Snodgrass. I'd like to go back to Councillor Barton's comments. And then today I noticed we do have an in-camera session. Would it be possible to add Councillor Barton's concerns to that in-camera session, since it is specific about a specific employee? Should we have that discussion? Because I don't want to see it be sort of washed away. This is very important, obviously, to that employee. It's important to us as an employer, and we should hear it out.
We will add a labor item to the special meeting to discuss this.
Thank you, Mayor Snodgrass.
You're welcome. Any other questions on this? Thanks very much for discussing it, Jenny. Well done. Committee of the whole. So the end of it is a wide open Q&A. Fire at somebody. When ready. Who? Nothing. I will adjourn the meeting at 1:13 p.m. See you at 2 o'clock.